Welcome back to the AATS Mitral Conclave 2015. I'm really happy now to be joined by Dr. Marc Moon. Marc is not only Chief of Cardiac Surgery at WashU in St. Louis, but is also Secretary of the AATS. Marc, thanks for joining us.
Great to be here.
Thanks for having us, and thanks for all the welcome. It's
great to be here.
So, Marc, the phenomenal meeting here today. I mean, this morning, the room is packed, 1,200 people, 1,100 people. From the AATS perspective, what's this meeting mean to AATS and to AATS Week?
Well, the AATS, as you know, is about scholarship, innovation, leadership, and I think the contribution of the Mitral Conclave to the educational offerings of the AATS is right in line with our mission. The innovation we're hearing about today, whether it be percutaneous, whether it be new operative techniques, has been phenomenal. I think there's been a move in the AATS in the last decade to become more surgeon-focused, talking about surgery, not the politics of surgery or the workings of the healthcare industry that we can't really impact too much from our perspective, but how to take care of patients, how to improve our techniques, how to innovate, how to apply these very complex techniques in our own everyday practices. I'll tell you what, I just spent the last 30 minutes watching absolutely phenomenal new techniques of how I can better treat my patients with mitral valve disease.
And then this, your AATS week, I'm sure all the viewers will know that, but tell me a little bit about that concept, because where you have this meeting and then your annual meeting, is that correct?
Well, the AATS has reached out to meetings that we feel are appropriate to our mission and would go along with our mission, such as the Mitral Conclave and the Aortic Symposium, which alternate yearly. And we feel that having these meetings in conjunction with the AATS week is best for our surgeons who attend the meetings. They can focus 1 week on learning all the educational aspects of surgery that they need in that year. If they're mitral surgeons, they go to the Mitral Conclave. If they're aortic surgeons, they go to the Aortic Symposium. Always in New York. People love to come to New York. And maybe someday we'll have the AATS meeting here as well to follow.
It'd be a little easier on transportation.
Absolutely.
No, but I think it's great. So since the AATS, and I love what you said, your mission is innovation, obviously education. How do we continue to educate the surgeon or the cardiologist of the future? Is it through big meetings like this? Is it online education? Is it tutorials? Is it? Well, I think that's an interesting challenge.
Talking to Frank Spencer, one of our past presidents many years ago, the AATS, there's been talk about sort of web-based education and learning by watching internet. I feel that lacks the personal aspect, the ability to ask questions one-on-one. Maybe you're a little shy to get up and ask a question in front of 1,000 people, but once the presentation's over, David Adams, Tyrone David, Craig Miller are all very approachable. They're the studs of mitral valve surgery, if you might say, and it just gives you a chance to talk to them. Maybe the guy who is just building his practice, they'll listen to him as much as they will the other guys on the podium, and it's a fascinating group of individuals. So I think the interaction that you get, not only with the presenters, with other people who are maybe dealing with the same kinds of trouble you're having with mitral valve problems, can offer suggestions to improve your practice.
Well, you all ought to be really, really congratulated. I mean, this is a tremendously successful meeting, and the vibrancy of the education, and then it will continue in your national meeting. So, thank you and the AATS for really spearheading this. I mean, I'm learning an immense amount, and so I think it's very exciting.
I think the AATS has become about, like I said, it's about scholarship and innovation, but also about getting back to patient care, treating patients, becoming better surgeons ourselves. It's an association for thoracic surgery, but almost all of our members are surgeons, practicing surgeons, and good surgeons. And I'm proud to be part of it.
Yeah, well, you said great segue. Excellence in patient care is really the thing. Thanks so much for joining me.
All right, thank you.
Good. Thank you.